So in this video, I want to discuss a non-fat belly. What do I mean by that? Well, it's a situation where a person has this protruded stomach, okay, but it's not coming from fat. There's not a lot of fat going on. It's actually fluid, and the name for it is called ascites. I talk about this in my book when I talk about the liver body type because it's a liver problem. What's happening is the liver is so damaged, they're getting this leaking of fluid and the accumulation of a protein fluid in the abdominal cavity. In this condition, you have the replacement of normal, healthy liver cells replaced with fibrous scar tissue. So you lose the function of the liver cells. And then that's why you get this buildup of fluid. So cirrhosis doesn't happen overnight. It takes years to develop. And a lot of times it's like asymptomatic. You won't even have any symptoms until you get it. Just years of maybe alcohol or poor eating, things like that. But it usually starts with inflammation. And the person will usually have a fatty liver as well. But this inflammation that's in there is part of an immune response, and the body just heals with scar tissue. Now, medically, what they do is they lower the sodium, okay, to decrease the fluid, and they put the person on diuretics, and they also drain out the fluid. And the reason I know this is because I had a patient who's a medical doctor who came in and told me what they do. They basically drain the fluid out. 2 or 3 weeks later, they're back for the same procedure. And I asked him, I said, why don't they address the diet? And he says, well, we're just not taught that. So what I want to talk about is what I would recommend for this situation. Number one, I would recommend getting to the actual source of what causes the inflammation in the first place in the fatty liver. Refined carbs, sugar, things like that. So you want to lower the carbohydrates, all right? You want to stop all alcohol, and including the wine on the weekends. Go cold turkey because alcohol is just going to keep irritating the liver. There's solvents in there. That's going to be a problem. Number 3, moderate amount of protein. If you do too much protein, excessive amounts of protein, let's say over 8 or 9 or 10 or 12 ounces in a given meal, that's going to be too much. And potentially you could generate too much waste, ammonia, and that can affect the brain because the liver processes this protein, and so you don't want to overload it. So I guess the perfect amount would be between 3 to 6 ounces per meal. And you don't want to go crazy with too much fat either. Maybe a moderate amount of fat. Why? Because when you cause damage to the liver cells, you also don't produce the bile. Bile is produced by the liver, not the gallbladder. The gallbladder just stores the bile, but the liver makes the bile. So people with cirrhosis don't have the amount of bile to digest large amounts of dietary fat. So that could be a problem. Number 4, cruciferous vegetables. Why? Well, for several reasons. One is that cruciferous vegetables have a lot more phytonutrients, which are really beneficial to protect against the damage of oxidative stress in the liver, to help phase 1, phase 2 detoxification. Plus, it's going to provide a lot of potassium and other nutrients to help the fluid balance. So instead of reducing sodium, I think a much better strategy would be to increase potassium, simply because we need a lot more potassium. So this would be important. Also, the fiber from the vegetables will feed the microbes, which will then help you recycle bile. 90% of the bile, which helps emulsify fat and helps keep the liver from becoming too fatty, is made from the microbes. So you want to feed them, right? Number 5, intermittent fasting. Very, very important. Why? Because it will drop inflammation, which is why the person has cirrhosis in the first place. Very important for healing through the entire digestive tract. All right, number 6, time. You have to be realistic. If you have cirrhosis, you have to realize that's a very serious condition of your liver. And it may even be too far gone where you need a liver transplant. But here's the point and why I'm bringing this up. Well, I had this guy come in, and he was a patient, and he had cirrhosis. He had a lot of liver problems. And in his mind, he was going to get well in maybe 3 to 4 weeks, okay? And I told him, I said, the liver is one of the largest organs in the body. It takes sometimes years. And I found it was really, really hard for him to stay consistent with doing the right things over a period of time. He just couldn't do it. I don't know what happened to him, but the point is that if you have liver damage, it may be too far gone where you might need a liver transplant. So really, you need to have the estimation of effort it's going to take to handle this problem, which it's a big problem. All right, I'll talk to you later. So if you're enjoying this content, go ahead and share it with someone that could really benefit from it.